implementation of the system. From intuitive, so the system comes with components. This is the surgeon console where the surgeon sits and operates on the patient and takes the entire control initially. This is patient card and that one over there is vision card. Giving you an overview of the surgeon console. So the surgeon sits here. Surgeon sits here and rests their head over here. Till the time surgeon does not rest their head because there are sensors. Till the time the surgeon does not put their head here, machine does not do a normal surgery. So there is a very common notion that people say कि robot surgery करता है. Is it safe? So it is entirely safe because till the time the surgeon is out there, it will not move a inch. This is where the surgeon takes control of the instruments. So the surgeon's hands go here and this is where they see the 3D vision of the surgical anatomy. So the surgeon has 3D HD vision of the anatomy, the surgical anatomy, and also they have a 10 times magnified view. So what we can see from our eyes, they will see a 10 times magnified view. Imagine looking at a very fine nerve where even a single nerve bleeding can make difference to the patient. When they are able to see it with 10x magnification, it comes in very handy and very safe for the patient. So this is where the surgeon sits and operates entirely. These are the pedals out there through which different functions happen and different regulations and controls happen. Coming to what goes on the patient, this is the patient card as the name suggests. So this model over here is demonstrating the patient card. So these forearms go on the patient through these trocars, through these kind of 8 mm trocars, and because of these arms attached to these trocars, and that's how you install the instrument in here. So these are our instruments. One key feature of the instrument is they have 7 degrees of freedom. For example, just take your hand like this. Can you rotate it further in that direction? So these instruments are 540 degrees of rotation. Even beyond what we have learned since childhood, 360 degrees, it has 540 degrees of rotation. So there's no limitation to the surgeon's hand or movement when they want to operate on a patient. And it also comes with 7 degrees of freedom. So there are 7 ways, 7 movement tactics that the surgeon can utilize because of these instruments. So the instruments that attached here, and that's how the instruments look over there. So the movement that the surgeon is doing over there, for example, just have your eyes on the screen. Do you see the instrument moving? Yeah. So this is how fine the instrument moves, and here you are having a 2D view, but in reality the surgeon is having a 3D view. And it's a magnified clear view, and if there is any tremor on my hand now, that is not going to reflect on the instrument. So any tremor, filtration, all the movements are going to be very precise and very fine on the patient, which is very important for any surgery. So the robot comes with 4 arms. So for surgeon, we are used to having 2 arms, but the surgeon has 3 arms. So for example, imagine when we are doing makeup, right? I want to apply eyeliner. I don't have a mirror mounted on the wall. I need someone to hold a mirror. Imagine if I had 3 hands, I could hold the mirror the way I wanted to. I could hold my eye and I could hold the brush. So this is exactly what it does. So for example, surgeon wants to hold a particular anatomy and operate on a structure that is lying underneath it. So they can just use their forearm, hold that arm up, hold that tissue up, and then leave the arm right there and then operate. So a surgeon can operate with 2 arms at a time, but they have these 3 arms, so they can activate 2 arms at a time, but they can utilize all 3 arms while operating. So this is about it. Basically what happens with the robotic surgery is the patient is going to have very minimal holes, 8 mm holes, which are like peanut sized holes, and the instruments are going to it, and you can imagine a surgeon getting an entry into the patient anatomy through merely 3 holes. And they can operate. The entire hands are out there, and the entire hands are in there, and they can operate from there. That one is the vision card. So, for example, a surgeon is the captain of the ship. But in the ship there are multiple passengers, right? There are circulating staff in the OT. Everyone can communicate with the surgeon from here. For example, a surgeon is speaking to someone. So they can use the illustration. So they can tell them कि यहाँ पे कट करो या यहाँ पर जाओ. For example, the there are two surgeons, different specialty surgeons operating together, and they want to say कि सर यहाँ पे मुझे लग रहा है कि थोड़ा oozing हो रहा है या थोड़ा blood आ रहा है, तो they can just tell वहाँ पे surgeon को treat even इतना जो भी मार्क यहाँ पे लगेगा surgeon can see it over there. So this is how the communication is effective. All the instrument names, everything, what is happening over there, the OT staff can see it over there. And also someone who is exchanging the instruments for the surgeon, for example, they are not doing it blindly. They have a vision of what is happening inside. So that is how the team is coordinating with the surgeon in the. So all three systems are in, all three parts are integrated with each other through a blue cable, and that's how the system works in integration together. This is the energy source. Basically, it is again integrated with the system. They can have two bipolar and monopolar instruments at a time. That is how obviously everything is surgeon preference day to day. But this is what is provided in the source. So robotic surgery, as we say, and I would request you when you put it in the media, one awareness feature is people think it's not say that it's a robot that is performing surgery. People really need to understand it's their surgeon only operating on them just with advanced technology. But the moment that surgeon is not around, this robot is not going to even move.
So it is safer.
It is very safe. It is extremely safe. And imagine looking at something
maybe more precise,
more fine. Blood loss कम होता है. There is lesser blood loss. The recovery is faster. We have seen, for example, if I talk about a fibroid removal surgery, laparoscopy में if a patient is getting discharged after 2 to 3 days, यहाँ पर patient may be discharged after 1 day. Obviously, every patient has different condition, and the outcome, clinical outcome, depends on the patient and the surgeon. But this is just for example. It reduces your time to stay in the hospital, and very key feature is you're back to your normal life very sooner as compared to the other ways. So these are some benefits of robotic surgery: lesser pain, lesser blood loss, more precise surgery. The surgeon can just target the area that they want to target. If it's an onco surgery or cancer surgery, the cancer clearance is better because you are able to see it better, you are able to access the area. If there's a deeper tissue, for example, in males, if there's a prostatectomy that will happen, it's a prostatectomy. It's a very confined space. You need to create space. If you're doing an open or laparoscopic surgery, that becomes a challenge. But during that, this comes in very handy to the surgeon. It eases the surgery for the surgeon. Also, the console that we saw over there is completely automatic. So the height, the height of the handrest, the height of the vision, the position of the pedals, surgeon can adjust as per their requirement. So their backs are not very good, back and leg will not be this. So basically, we say it very often as a joke and as a humor as well that operating on the robotic surgery increases the surgical life of a surgeon.
Definitely, you save the back and the neck.
Yes. So this is the. I hope I was able to
Yes, definitely.
get you what will be.